how to start the conversation about palliative with your provider. So this was a question that was asked in the comment section that I feel like was so important, and there are a few other pieces that I'm going to address as well. A lot of times I've heard through the grapevine that whenever a patient will ask about palliative care, the doctor will say, "Whoa, it's not time for palliative care." What does that even mean? So it's not like you have to be terminal to see palliative care. It's not like you have to have a life-limiting illness that is going to likely take your life in the next 6 months to see palliative care. Now, do you need to have a chronic illness that is limiting your life and affecting your quality of life and could ultimately be life limiting in the end? Yeah, I mean, those are the people that are going to benefit from palliative care, but also patients like cancer patients who are going for cure but have a lot of symptoms. That's something that is really worthwhile to see palliative care. How do you ask about it? So I think if you ask about it, you say, "Hey, I heard about palliative care and I think that they could provide me some extra support. What are your thoughts?" And if that's what your doctor says is, "Wow, it's not time for palliative care yet," say, "I actually think I would like to see them and they will help me decide if it's time or not." A consult doesn't hurt anything, okay? So even if you see a palliative provider and they say, "We don't really have a whole lot to offer you yet, but we can follow up once a year and check in and see if there's something that changes," I think that's pretty worthwhile, especially if you have, a disease that could potentially change your life with time. Now, I will caveat that with, we do get a lot of consults for chronic pain management in patients that also have other chronic illnesses. So I think sometimes a misconception is that because you have chronic illnesses and other pain, palliative will treat your other pain, and that's not always the case. Not every palliative program can treat all different pain. We mostly focus on cancer pain and end-of-life pain, but that doesn't mean those are the only things we treat. So we also see patients with CHF, COPD, liver disease, kidney disease, dementia, ALS, all kinds of things. Any of these diseases that are life-altering and really the quality of your life is diminished because of them, we do see. One of the pieces of this question was, as a caregiver, what can you expect during your loved one's part of this journey? And I think one thing that you can expect is it's going to get harder. So you are going to need as much support as you can possibly get. And I think that's where palliative can be helpful in at least guiding you to more resources. And the last piece of this question was, how do you make the best of a scary situation? So preparation. Preparation makes a scary situation just slightly less scary because you've already talked about it in advance. You are preparing for the what ifs of the future. You are working to have the best quality time that you can now and enjoy the time that you have now. So I really loved this question. Thank you so much for this. And please keep the questions coming. And as always, follow along for more.